Good evening again. It's so great to see everybody here. My name's Kevin Tabb. I am the president and CEO of Beth Israel Lahey Health, and it's really my privilege to welcome you all to our new facility. Now, I got a script here, but I'm already going to go off script and just say, wow. What an amazing event. What amazing turnout we have here. And I'm going to, speak from a place of pride and also say what an amazing building to have this event in. I will tell you that we just cut the ribbon on this building a few weeks ago, and it's not yet open. We don't yet have patients here. We will soon. But this event, the Greater Boston Food Bank event, is the very first event that we are holding in this building. And I will tell you that I can't think of another organization or another event that I would rather have here as the very first event, because this symbolizes who we are and our values, and we couldn't be happier to be here with all of you today, hosting the Food is Health event. So thank you for joining us this evening. We've got a great program in store with you. To date, written here actually, it says that there have been 8 of these events. I think there have actually been 11, although 8 in person. And it is really great to be back in person and to have everybody back together for the 8th or 11th of these events. 10 years ago, Dr. Alan Hamdan really rallied all of us, the Beth Israel Deaconess community, to launch this initiative. And he has been at the heart of this, and we have all been committed ever since. So we're tremendously thrilled that there are so many people here from our Beth Israel Deaconess community, and not just from the Beth Israel Deaconess community, but from really across Boston. The entire region's healthcare community gathers together. And I was told that the only reason that we have this number of people and not twice as many is the fire marshal said we can't put any more people in here. That's great. We are absolutely full. And as we've grown this event, and this event has absolutely grown, we're really excited to grow partnerships that we have throughout the region, and partnerships that cross hospital walls. Hospitals in Boston can be pretty competitive sometimes. I don't know if you know that, but it's actually true. And I'm not at all competitive, although I will say I think we certainly have the best people and now the best building in Boston. But I love the fact that we come together around the important things. And this is one of the important things, because when we think about hunger in the community and feeding the communities that we serve, I can't think of anything more important. Food is health, and that's what we're all about. So now, without further ado, it's my distinct pleasure to introduce Catherine D'Amato, President and CEO of the Greater Boston Food Bank. Catherine has been really a tireless advocate for the hungry for over 40 years. And at the helm of this organization for a very long time, since 1995. Thank you, Catherine, and welcome.
Thank you very much. Appreciate being here tonight. We're very grateful for the continued leadership in supporting the Food is Health event. And let me begin with a special thank you first to Beth Israel Lahey Health and to Beth Israel Deaconess Medical Center for graciously having us here with you this evening. As was noted, being the first is hopefully memorable, and 100 events later, and thousands and hundreds of thousands probably of dollars that will help people become healthier and to move from hunger to health will be what matters here. And also just want to thank all of you for showing up. It's a really important time for us to be thinking about these things together. But I do want to highlight a number of examples that Beth Israel Deaconess Medical Center addressed around these issues. One was Chelsea Eats, an innovative pilot program providing residents with monthly assistance purchasing food. And they also did their Bowdoin Street Health Center, who delivers to more than 11,000 patients annually, and its Food for Health initiative has been transforming. The center distributed over 200,000 pounds of food door to door and increased food access, providing patients with certificates to use towards fresh food and produce and to get baby formula and food prescriptions. BIDMC also supported the DIMIC Center, which many of you know, during the pandemic, which addressed food insecurity among patients and residents through a gift card program. So to Beth Israel community, we thank you. We thank you for addressing food insecurity and for your continued support through the years in all of these programs. Also, my job is to thank our sponsors, right? So we want to thank Bristol Myers Squibb as a presenting sponsor, and to Joel and Randy Cutler as well. And you also know, many of you know Carol and Howard Anderson, who have been champions on this issue, whether it be the Greater Boston Food Bank, whether it be Deaconess, whether it be a new center, whether it be a Pantry in the state of Vermont, whatever it might be, they've been there. So I want to thank you. And we're so appreciative. You know, there are so many folks to thank. We put them on the screens because we couldn't possibly, you would have been here till midnight. So we do want you to know that those folks are wearing special ribbons, and please take a moment to say thanks, and because they stepped forward, and we're very grateful. And it just demonstrates investment and things that we care about. And of course, it wouldn't be a success without the work of the committee. There are lots of folks around here that also have special ribbons, so just thank them. They stepped forward, they did something. Action's one of the most important things. Don't be indifferent. Act, do something. So on behalf of all of us, please accept our very heartfelt thanks. So as the Greater Boston Food Bank continues to address its mission to feed those across eastern Massachusetts, we believe that access to healthy food is a human right. We believe that no matter the circumstances, everyone has and should have access to healthy food and proper nutrition. And in this post-pandemic world, we are determined to meet this growing and ever-challenging need of our community by removing barriers and creating equitable access to nutritious food and culturally responsive foods through a lot of available resources. By achieving that food security, we know that there will be opportunities for our neighbors to thrive and have restored hope. So this is a very pervasive and historic growth of food insecurity at this time. It's unprecedented. We've seen inflation at historic rates, and food inflation, highest in 40 years, that people are facing. 1 in 3 people in our Commonwealth now face food insecurity. I'm going to say it again. 1 in 3 in the Commonwealth now face food insecurity. In March 2020, I would have told you that number was 1 in 8, 1 in 9. The world has changed. So we work with over 600 partner distribution agencies throughout eastern Massachusetts, and the equivalency of the food that we've been able to distribute over that time has been millions of meals. And we're proud for this long-standing commitment to nutrition and providing nutritious food. My team often hears me say this, that people think we're a priest in a basement giving out canned goods. Now, I can say that because I was raised Catholic, but we're not. That's not what we do. And so it's important that you know that's not what we do. And that's something that we have to do better at. We're one of the first food banks in the nation to actually have a nutrition policy. One of the first food banks in the nation to have full-time dietitians, registered dietitians. Must be a dietitian. You, I think, are outnumbered by MDs in this room. But They work closely with our food purchasing program. If you're buying over $50 million worth of food to distribute millions of equivalent meals out to 600,000 people each and every month, you need to have good collaboration between the dietitians and the food purchaser. And this just is an amazing thing, because now 96% of all the food distributed from the Greater Boston Food Bank meets high nutritional standards. That's huge. So what it means is that you can work with this 600 partners throughout 190 cities and towns. This is pantries, community meal programs, shelters, mobile markets. And over the past 10 years, our community investment grants program has given out about $5.5 million into these programs, because it's great. We could go get all the food that we could possibly raise, but if those programs on the ground can't distribute it, can't store it, can't have the right refrigeration, can't have the right distribution systems, then it doesn't really matter. So that investment is huge. In addition to food access, the work done here at BIDMC and many of our partners, some of are in the room today, have focused their mission to provide innovations and medically tailored meals, such as community servings. Many of you know that program. Or they're providing food prescriptions over at Boston Medical Center at their food pantry. And newly formed pantry at Boston Children's, or measuring health outcomes through plant-based nutrition at Mass General Brigham's Revere Food Pantry. And then there's Cambridge Health Alliance, produce-only mobile market, or providing a stable, consistent, nutritious groceries through the Weymouth Food Pantry. Or let's talk about the YWCA at Gloucester, or the Open Door. There are so many. There's a community market in our area through the Y as well. And then the Medway Village Food Pantry. All of these programs have something in common. It might not be something you would guess. They all get at least 80% of their food from the Greater Boston Food Bank. That's what we do best. And that's where we can cause and affect this headline, that food is health, and really transform that. So we're committed. The President's White House conference gave out the desire to say, let's try to fix this by 2030. And in Massachusetts, we have a cohort of agencies that do want to fix that. And you're all part of that as well. So the conference was focused on hunger, nutrition, and health. And let me tell you, there was a bit of a fight to get all those words together. But we got there. And with that in mind, the goal is to do a number of things, like bring highlight to the Hunger to Health Collaboratory, founded by GBFB, to promote models that address health inequities by supporting upstream solutions. Our senior health and research advisor, who is here this evening, is advancing critical nutrition and food insecurity research to end hunger and fight diet-related diseases. Then you have our public policy team that's utilizing research to advance equitable policy solutions. And then we have our SNAP team that's researching deep and reaching deep into communities. And if you haven't followed the news today and tomorrow, you will learn about the sunsetting of these very critical SNAP benefits that are going to hit a number of families on average to lose about $185 a month. It's significant. It's deeply significant. So all these programs mentioned, they all want to do something. And the fact that we can join forces with you means it's even more powerful, that we're not in our verticals alone, but that we are here together to move efforts towards focusing on this intersectionality of food, health, and nutrition. This is how we will improve the health of current and future patients everywhere. So we can end hunger. It is solvable. Healthy, nutritious food coupled with policy and these innovative partnerships is going to push us forward. So, yes, I've been an advocate for 40 years, and there's a lot of folks that say, well, what the hell are you still doing here, right? Because I'm hopeful. I'm hopeful, and I believe that it can actually happen. And I think Massachusetts could be the first state in the nation to be food secure, and that's because of many of you, and we will need you. So thank you for your commitment to equalizing access to healthy food as a human right, and thank you for being a critical component of healthcare. So now let me bring this vision to life. I'm honored to introduce Dr. Jacob Mirsky, the Medical Director of Mass General Brigham Food Pantry in Revere. I think, here he is. Come on in, Doctor. I'm open to your page. Good luck. Okay.
And I don't know if everyone knew I was from MGH when I came here, so I just want to make sure, is that okay? How much time do I have? Okay, great, thank you. So good evening, and thank you so much to the Greater Boston Food Bank for inviting me tonight to share a few remarks about the MGH Revere Food Pantry. I'm honored to share with you the story of how this initiative began and how it's transformed the lives of so many of our patients in Revere. Almost 10 years ago, as a resident at Brigham and Women's Hospital just a few blocks away, I became acutely aware of the connection between food and chronic disease. I saw firsthand how nutrition and hunger played a critical role in the health of patients, and I knew that we needed to find a better way to prevent and treat chronic disease by prioritizing access to healthy food. I was fortunate to have the support of my program director, Dr. Bill Taylor, a legendary primary care physician at Beth Israel, who encouraged me to explore my interests in the greater Boston area. I spent time learning from local nonprofits, including Community Servings and Boston Medical Center, and eventually found my way to the Greater Boston Food Bank. It was there that I met Dr. Brodowski, a physician leading GBFB's health and research work at the time, who invited me to this very event when it was held at the warehouse, and I knew that my work promoting food as medicine was only just beginning. When I arrived at Mass General Hospital's Revere Healthcare Center to start my career as a primary care physician, I was fortunate to be surrounded by like-minded colleagues, including the medical and administrative directors of the health center, Dr. Roger Pazinski and Debbie Jacobson, who shared my vision for building a healthy food pantry in our clinic. We wanted to create a pantry that put health on equal footing with hunger, and that's how the mission and vision of creating the healthiest food pantry in the area began. We made a conscious decision from day one to only provide our patients with plant-based foods, because we knew that the prevention and treatment of chronic diseases, such as diabetes, high blood pressure, obesity, and heart disease, depends on promoting the consumption and enjoyment of plant-based foods such as fruits, vegetables, whole grains, nuts, and legumes. We opened our doors in January 2020 thanks to our amazing manager, Michael Lenson. We had a delightful ribbon-cutting ceremony in February 2020 and immediately decided to drastically alter our course in March 2020 when the COVID-19 pandemic hit our community. Although we started by only serving 8 to 10 patients, we decided to immediately open up our doors to all patients served in the health center in response to the dire situation we were seeing around us. Revere, like Chelsea, was one of the hardest hit communities in America during those early days of COVID, and our mission quickly became serving as many patients as we possibly could. Fortunately, it was around that time when our connection to the Greater Boston Food Bank became official. Almost immediately, we received thousands of pounds of plant-based foods every week, which we distributed to our patients in need, again, thanks to Michael. The ability to acquire almost entirely for free such delicious and nutritious food was critical, and it remains so to this day. Revere has no farms, little infrastructure to support farmers markets, and an overwhelming number of fast food chain restaurants. Our connection with the Greater Boston Food Bank only strengthened soon after we opened, when we were fortunate, and I was delighted, to partner with Dr. Lauren Fichtner, a colleague of mine at Mass General Hospital, and as mentioned, the Senior Health and Research Advisor at the Greater Boston Food Bank, who is here, but I can't see. Lauren's team has helped us analyze data, showing that our food limited weight gain in children with overweight and obesity during the pandemic. And now we are co-principal investigators on research grants assessing the health, psychological improvements, and other outcomes on all the patients that we serve. We're dedicated to backing up our claim, I guess I'm competitive too, of having the healthiest food pantry in the Greater Boston area, and we can only do this by demonstrating health improvements in the patients that we serve. We could not be more appreciative of the critical role that the Greater Boston Food Bank has played in our history. Just last year, we received over $50,000 worth of donated food, which amounted to almost 120,000 pounds of exclusively plant-based foods for our patients. The impact of such generosity and dedication to fighting hunger has been immeasurable, and we, myself included, are deeply grateful for the support. To share the impact that such generosity and dedication to fighting hunger has had on our patients, I'd like to introduce one of our very first patients in the food pantry who's been receiving food from us for almost 3 years, Billy Joe.
Good evening, everyone. I wish I could come out and give you all a hug for doing what you do for us. My name is Billy Joe, like he said. I've been a patient at MGH for over 30 years. Over the years, I've struggled with my weight. I have all the risk factors that the doctor mentioned: high blood pressure, obesity, diabetes. And through the food pantry, they've helped me get more healthy foods into my diet. They've shared healthy recipes with us using the food that they give us each week in a recipe, show us how to make it, provide a sample for us, and just everything that they do is up and beyond. They never treated me like a less than. The food that they give us is, like the doctor said, fruits and vegetables. And if it wasn't for them showing me how to use some of these foods, I would have never have tried it. If it wasn't for them sharing recipes, I would never know what to do with it. Michael, he's a great support. He's right over there. I see him over there. He's always been there from day one with me. I met the nutritionist, Milani. Unfortunately, she retired. But she's the one who got me to learn how to do portions and low sodium. I never would have tried the wheat pasta, the brown rice, all the healthy stuff. When I seen low sodium on a can of beans, I was like, ugh. But then I tried it, and things just fell into place. And because of the pandemic, we had to stop the in-person, because they used to get together, like I said, and make recipes and share with us. But since the pandemic, they actually bring food to my house. They call me every Wednesday, and then Thursday they bring the food. And even sometimes in the boxes that they bring, they'll put in a recipe for us to try. Unfortunately, my mother passed when I was young, so I never learned how to use spices and stuff like that. And they've given me recipes to how to use spices to flavor my food with less salt and less sugar and stuff by using Mrs. Dash and stuff like that. So I just really thank all of you for all what you do for us, because if it wasn't for you, I wouldn't be able to afford, I wouldn't be able to afford a lot of the fruits and vegetables that I'm given to every week. So I really appreciate each and every one of you. I wish I could reach out and hug you all. And I pray that you'll continue to help us. We really do need it. I live in Chelsea. I'm one of the ones that got hit hard. My husband doesn't work now, so it's been really difficult. And because of you people, we wouldn't be, if it wasn't for you people, we wouldn't be able to have the stuff that we have. And I greatly appreciate everything that you guys do for us. Thank you.
Thank you. You're good. You're great.
I have to admit I'm a little overwhelmed. First, can we give another round of applause to Beth? I'm going to go a little off script, but I won't be super long. My name's Alan Hamdan. I'm a vascular surgeon here, and I've been part of the food bank for about 12 years. I first learned about food banks when I was a teenager in New Jersey at my first Bruce Springsteen concert. And it just sort of sat in the back of my mind. And then I had the privilege of two really important conversations. The first was in 2011. I went into Dr. Chaikoff, our chairman's office, and said, seems like we spend a lot of money on parties. Why don't we just give money to the food bank? And he said, well, it's a really noble idea, but you can't just all of a sudden do something like that. Let's make this a little bit bigger. He said, why don't you start a committee and see what people in the department want? It was not the answer I wanted, but it was the right answer. About a year later, I got an introduction and I walked into Catherine's boardroom. And I literally said, I'm a physician. I think we should do more for people who are hungry, but I have no idea what to do. And she looked at me and she smiled and she said, you really don't know what to do or what you're doing, do you? But we'll help you. And then that's how this started. Thank you to Dr. Tabb for speaking, Dr. Mirsky, Billy Joe. From the beginning, the goal of the event has been twofold: to raise awareness and to expand support within the healthcare community for the critically important foundational work that the Greater Boston Food Bank does. We also hope to deepen your understanding of the intersection that exists between ending hunger, good nutrition, and health. If you would like to know more, please visit the food bank's registered dietitians in the back, and also spend some more money. I also want to say how proud I am to be part of this healthcare organization. I love this hospital for what it does, but I love it more for this. Thank you to Dr. Tabb and to Dr. Chaikoff, because honestly, this is not a normal hospital thing, right? This isn't something that you just show up and do and raise money for a cause like this, and it really deepens my affection for this institution. All right. So now it's back to the ask, all right? So we're going to mingle. There's a lot of cocktails. Hopefully there's new wine back there. There's a lot of food. So let me give you an update. So our biggest year before, we raised $125,000, and I thought that was amazing. We're currently at $280,000, which is humbling, but it's not enough. All right, we want $315,000. So please think about going to the back of the room and donating more. Please go into the silent auction room and bid more. That's really what we're here for. Obviously, we want to raise awareness, but ultimately we want some money. So 315 is our goal. But anyway, thank you for all of your attention. Thank all you've done already. And have a great rest of the night.